asking employees to commit to protecting themselves and their coworkers, as well as their customers, while they serve. And we're giving them very specific and detailed guidelines to help them do just that. While we highlighted restaurants and retail last week, we also issued universal business guidance that's available on our website that we urge every Tennessee business to follow. Our economic recovery efforts are about providing businesses the tools that they need to forge a methodical, data-backed way forward as we fight this public health crisis together. We are pleased to see restaurants opening today and the great efforts they're making to adopt the Tennessee Pledge. I noticed this morning that Puckett's Restaurant welcomed customers to breakfast with tables spread apart, utilizing personal protective equipment, customer spacing. That is the essence of the Tennessee Pledge, and we commend their work and work just like it that's happening all across our state. While many Tennesseans start the process of safely returning to work, we remind businesses that have utilized the work from home strategies to continue to do so when at all possible. At the state level, we will continue to keep employees working from home until May 26th. This means that state services can continue without disruption as we work toward the gradual return of working in the office. We know that social distancing works, and it's critical. And we can't just throw the doors open while we know that a very serious health risk still exists in our state. So we've cracked the door open so that we can give those that are unemployed and business owners some light and some hope that there is a place that we're going that's different from where we are today, which is unsustainable. 1 in 6 Tennesseans face unemployment. Cracking this door on our economy will allow us all to see a little light and know that there is a way forward. Tennesseans have made tremendous sacrifices throughout the process, and we recognize the implications that these decisions have made on lives and on livelihoods moving forward. The state of Tennessee will continue to weigh appropriate measures to ensure that we're fiscally conservative as well through this economic downturn. To that end, I've directed the Department of Finance and Administration to temporarily freeze any non-mission critical hires to our state's workforce. During our time today, I want to discuss our call with the White House today and conversation around expanded testing. I want to talk about the return of elective procedures to our hospitals this week, and we'll also preview our efforts to begin antibody testing here in Tennessee. Today we have 9,918 confirmed COVID cases in the state of Tennessee. We have lost 184 Tennesseans to COVID. 4,720 have recovered, and we have tested over 154,000 people here in our state. Earlier today, I participated on a weekly call with the White House. The conversation was centered around 2 subjects. One, primarily the expansion of aggressive testing all across our country. And the other was about the opening and rebooting of the economy in states across America. I spoke with the President myself on the call today. The Trump administration has been insightful. They've been accessible. They've been very helpful to us as we have forged our way through this pandemic, and we will continue to work with the Trump administration going forward in this process. Over the weekend, we continued our effort to expand testing to every Tennessean regardless of symptoms. With the help of the National Guard and the Department of Health personnel, we conducted 7,000 tests on our surge testing over the weekend. We have conducted more than 18,000 tests over the last 2 weeks through those efforts, which has been a part of how we have been able to test over 150,000 people here in Tennessee. Aggressive testing is key to our reopening strategy. I want all Tennesseans to remember they can receive a free COVID-19 test at any of our county health departments across the state Monday through Friday. We encourage Tennesseans to do this. We need more Tennesseans to get out there and get a test, especially if you are returning to work. On Friday, we're also going to start back appropriate elective medical procedures so that we can get nurses and other hospital workers back to work. We feel it's important to get hospitals back online with elective procedures so Tennesseans can safely resume more routine services, including scheduling quality of life procedures. Procedures like routine screenings and joint replacements are included in this first wave. I'm going to have Dr. Wendy Long in a few minutes from the Tennessee Hospital Association to share more about what this means for healthcare in Tennessee. As I said that we're cracking the door, I also want to remind you that there are some businesses that we will not be able to reopen this week, and we'll be providing more information about that in the coming days as those decisions are made. I now want to invite Dr. Long, Tennessee Hospital Association, to talk more expansively about the return of elective procedures here in Tennessee. Dr. Long.
Thank you, Governor. As we talk about reopening parts of our economy, including the resumption of elective medical procedures, I think it's important to reiterate that we're having these conversations because the efforts to flatten the curve are working. Hospitals and healthcare workers are incredibly grateful for all the difficult steps and decisions that our state leaders have made, as well as those that families and individuals are making every day to help bend the curve and to assure that our healthcare system does not become overwhelmed to the detriment of us all. Hospitals have been in resource conservation mode since the beginning of this crisis in order to ensure that there are enough beds, ventilators, staff, and personal protective equipment in order to be available to address a surge in patients. This includes stopping services and procedures that are not urgent and encouraging the public to stay away from hospitals except in emergencies or situations that truly require a hospital level of care. Hospitals began delaying elective procedures and messaging to the public to stay at home even prior to the issuance of the associated executive orders because it was the right thing to do. But these efforts have come at great financial cost to hospitals, and we know many patients have been negatively impacted as well as they anxiously await procedures and care that have been delayed due to the crisis. As we plan for resuming outpatient and elective care and moving towards full operations again, hospitals want to be methodical about continuing to prioritize and monitor the use of resources while we see what happens with the spread of the virus as parts of the economy reopen. To that end, hospital leaders have been meeting with the governor and unified command for weeks, focused initially on surge planning and more recently on a cautious return to performing elective procedures. The result has been the development of guidelines for a responsible restart of elective care that were unanimously endorsed last week by the Tennessee Hospital Association Board of Directors. The guidelines require ongoing reporting of data regarding hospital capacity and COVID-19 patients to the Tennessee Department of Health. They promote a community-level approach to COVID-19 planning and response with regular meetings of hospital leadership to review disease trends and resource utilization. The guidelines require adequate and ongoing access to personal protective equipment and other supplies, clear policies regarding COVID-19 testing for patients and staff. And in addition, hospitals must have processes in place to screen patients, staff, and visitors for COVID-19 symptoms, to assure appropriate use of PPE throughout the facility, and to promote social distancing. And finally, the guidelines require a phased approach to restarting elective procedures with trigger points that would signal any need to scale back. The timing and approach for restarting elective care will be determined at the community level in accordance with these guidelines. And hospitals will be cleared to begin implementing their plans after attesting that they have completed the prerequisite steps and will continue to comply with the guidelines as they engage in elective procedures. Data submission and analysis will continue as operations scale up with vigilant monitoring of disease trends and resource utilization. So in closing, I want to thank the governor, Unified Command Director Stuart McWhirter, and Dr. Piercy for their tremendous efforts in response to the pandemic and for collaborating with hospitals and healthcare providers throughout this crisis. Tennessee has successfully flattened the curve such that hospitals throughout the state have abundant capacity to resume operations and will do so while assuring their ongoing ability to safely meet the needs of Tennessee communities. Thank you.
Thank you, Dr. Long. Let me just add my gratitude not only to the Tennessee Hospital Association and healthcare professionals across this state, but to the workers, the doctors, the nurses, the frontline workers who have and continue to put themselves on the front lines in battling COVID-19. Their courage, their commitment to the health and to the safety of the people of Tennessee has not gone unnoticed, and we are deeply grateful for their efforts going forward. Dr. Piercy, I'd like you to come up, please, and give our daily health report.
Thank you, sir. Good afternoon. As the governor mentioned, our case count today is 9,918, which is a 2.6% increase over yesterday. We have now surpassed the 150,000 test mark, which is remarkable, and we will continue growing that. Today, I want to take a little deeper dive into antibody testing. There's a growing level of interest in this emerging technology, so it's timely that we learn more about it and get clarity on what this testing can and can't tell us at this point. I'm going to go through a little common question and answer session, which is sometimes also called serology or serologic testing. When we talk about antibody testing, those are interchangeable, so if I say one or the other, I'm talking about the same thing. So one of the questions we often get is, how does this antibody test differ from the nasal swab offered at the testing centers? A typical nasal swab is for diagnosing a current infection. It detects viral particles found in the nose or throat and is useful during the time of infection and a few days afterwards. The antibody test, on the other hand, is a blood test to detect cells circulating in the body that have previously been exposed to the virus and have fought off the virus. So another question we get is, why is it important to use an approved antibody test? At last count, there were about 90 antibody tests being marketed, but only about 6 of them have been approved by the FDA, and those last 2 just came over the weekend. Most of the antibody tests that are in offices and clinical settings right now are not approved because the approved ones haven't been widely distributed yet. The problem with the tests that aren't validated is that they can give you a false positive. Most commonly, these false positives are what we call cross-reactive with other antibodies. This may come as a surprise to you, but coronavirus is a large category of viruses, and there are several different kinds. And many of those coronavirus types can just cause a common cold. It's not the same as what we call SARS-CoV-2, or the virus that causes COVID-19, but there are lots of viruses in the coronavirus family. Many of these unapproved antibody tests will pick up on those and not COVID-19 and can give you a false sense of security about your level of protection. Another question we get is, why is an antibody test useful and what can it tell us? At this point, we're still learning a lot about antibody tests. First of all, we believe that most people, probably not all, but most people that have COVID-19 do develop antibodies. But what we don't know is if the presence of antibodies is actually correlated with immunity. And even if it is, we're not sure how long that immunity lasts. Simply stated, we don't have enough data yet to prove that having the antibody prevents reinfection with COVID-19. There are some indications that this could be true, and we're learning more each week about the best clinical use of these tests. So, at least for the near future, the most reliable use of this data is for disease monitoring and public health decision making. Finally, what are our plans regarding antibody testing in Tennessee? As this is still emerging, you will see more and more of this in the coming weeks. But for this week, we have 2 plans in place. First, we will be sending out an alert to all clinical providers through a mechanism we call THON. And the THON alert will give technical details about the limitations of testing and will provide guidance to clinicians on when and how to use it. Secondly, we will be rolling out a plan to test up to 10,000 healthcare workers in our public teaching hospitals across the state. This will not only help us get a first look at what we call seroprevalence, or how many people in the population have the antibodies, but it will also start to inform us on how we develop our strategy going forward. We know that you want to know about your antibody status. We want to know about it too. But because the science is still emerging, we have to use what we know, and we have to develop a thoughtful strategy. So we're getting that process started this week, and we're looking forward to telling you more.
Thank you, Dr. Piercy. Later this week, we'll have more to say about guidelines specifically for gyms and guidance for houses of worship. Tennesseans must remember that social distancing, good hygiene, taking personal responsibility for health is going to be the only way that our state recovers. Remember to do your part, stay apart, and when in doubt, get a test. We'll be happy to open it up for questions now.
Thank you, Governor. First, we'll go to Kim Crucy with the AP. Kim, your line is open.
Hi, Governor. I was hoping you could help maybe shine some light on what happened over the weekend, the clarification that your office provided to local leaders regarding how much control they had on reopening their city. I'm particularly talking about the city of Chattanooga, where the mayor has come out and said he doesn't have local control to reopen his city and that it's a county issue. This kind of caught a lot of people off guard. Can you explain what happened there?
Yeah, so there are 89 counties in the state that the local health department is administered by the state. So the state has guidance and authority over 89 of the 95 counties. 6 counties have their own health departments, and those health departments will make the decisions about reopening, for example, in those communities at the guidance of the health department. We want this to be these to be data-driven decisions that are informed by public health officials, and those public health officials are in each county's health department.
Right, but do you think your office was clear enough in those instructions when the mayor of Chattanooga says he does not want to reopen his city, and yet his hands are tied, and he's just now finding out on Sunday that he can't reopen his city? So do you think your office was clear enough in your instructions?
We talk to I talk to those mayors personally. Every week we've talked about efforts to coordinate. Our economic recovery group has been in contact with each of those county mayors, city mayors. Many of them have supplied us with their plans, and there's been a real effort to make those opening strategies complementary. So I think that we've worked really hard as leaders. I've actually been very pleased with the way the leaders across the state have worked to make sure that we open the state in a way that's safe for Tennesseans.
Thank you.
Next, we'll go to Natalie Allison with the Tennessean. Natalie, your line is open.
Good afternoon, Governor.
Natalie.
I wanted to ask you about enforcement. So when you had initially put out the safer at home order, that was an urging, not a requirement. You changed that to a requirement because the state found that people weren't following that. So you all did have to put some teeth to that. So what has changed now? Why are the Tennessee Pledge guidelines only going to be guidelines and not enforceable requirements for businesses reopening?
Thanks, Natalie.
Why will people be following it now?
Yeah. So what we're doing is we are cracking the door to begin the process of opening our economy and to loosen restrictions. So we're actually in a strategy, and we're developing a plan forward that will loosen restrictions, not impose more restrictions. And I also want to say, I want to begin by saying that I don't start with the assumption that people are not going to follow or that businesses are not going to want to take this pledge. We know they're going to want to take this pledge. Businesses are compelled by a desire to create a safe environment for their customers and to create a safe environment for their employees. That's what business people do. That's how businesses stay in business. So we know that they're going to do that. That's why we have brought forth this Tennessee Pledge. We really want to work hand in hand with our businesses as opposed to a heavy-handed mandate. This is a time for loosening restrictions and allowing people to get back to work in a safe environment. Public safety is the utmost concern here, but we know that we can, in fact, return people to work and provide for the safety of those workers and customers as well.
The most recent executive order, there's a line in there that says restaurants are expected to operate in accordance with the Tennessee Pledge guidelines. But if a restaurant does not operate in a safe manner, or if health outcomes demonstrate a particular business is unable to operate in a safe manner, you may take additional action. Can you explain what you're thinking that might look like?
Well, you know, our public health offices all across the state license restaurants, for example, and always have, and they have the authority to make recommendations and to make changes to a way a restaurant operates all the time if they believe that restaurant's not operating up to public health standards. So again, this is a time for loosening restrictions and allowing restaurants to get back to work in a safe way. We know they're going to do that. If there is a bad operator out there, we certainly will want to work with that restaurant to bring them back to a place where they're creating a safe environment. But again, we actually think their customers are not going to want to walk into a restaurant that's not safe. They're not going to want to walk into a restaurant that hasn't taken the Tennessee Pledge. And frankly, we wouldn't want them to walk into a restaurant. We wouldn't want people to be working there as well. So we feel confident that this approach with our business owners and with the folks who work there is going to be a way for us to move forward and to find the path forward that allows for public safety and economic recovery at the same time.
Next, we'll go to Chris Bungard with WKRN. Chris, your line is open.
Thank you, Governor. I have another question along those same lines. As your administration, this comes from our newsroom, has your administration advised local jurisdictions to make direct contact with businesses about the various phases? Because there has been confusion, and aside from just going to the website, what do you advise them to do?
Yeah, well, we have provided very clear guidance on our website. We've also communicated that through the public awareness, just like what we're doing right here in this briefing. We have communicated frequently with our with the local jurisdictions. We've communicated. We have calls with county mayors. We have calls with city mayors. There's been a tremendous effort to coordinate this in a way that people know and those local jurisdictions know what those guidelines are and what the Tennessee Pledge is.
Governor, if I could follow up real quick with your word about the hiring freeze, can you talk about further conversations about state layoffs? Have you been having those conversations? Yeah,
we haven't talked about state layoffs. We've talked about being fiscally conservative through this period of time, knowing that the economy's taken a significant hit and budgets have taken a significant hit. The state budget will as well. So we have not talked about layoffs, but we have made that the step to not have any more new hires except for mission critical hires associated with attacking COVID-19.
Thank you, Governor.
Would you like to make a comment about that? Let me let Butch Ely, our Commissioner of F&A, make additional comments to that for you, Chris.
Thank you.
Thank you, Governor, and thank you, Chris, for that question. As you know, the Governor's been talking a lot about we're fighting this battle on two fronts. One, obviously, the medical side, and the other, the economic side. And so we know that the eventual impacts of this virus, we'll see come through in the state's revenues. We also know, just from our own records with the Department of Revenue, that, and this was in the Tennessee Pledge publication, that in March alone, 270 million occurred in loss of revenue from state industries like the hospitality industry. So we know that that kind of revenue loss is occurring out there in industry itself. And so from that, we know that the end result will certainly come to the states as well, and to our state budget as well. And so this was an effort from the governor to kind of get ahead of the curve and go ahead and put in some restraints on the budget so that we're ready as we approach the coming year. In addition to what the hiring freeze did, which also maintains the mission-critical hirings to go on, we also froze all equipment purchases so that we could begin to draw back on anything that was unnecessary. We've also asked each of our commissioners to restrain from any other kind of discretionary spending that they may have an opportunity to cut back on. And of course, I think you know, Chris, that we've maintained the travel ban also in effect during that time. So.
Thank you, Rich.
Thank you.
Next, we'll go to Sergio Martinez Beltran with WPLN. Sergio, your line is open.
Thank you, Guillermo. Good afternoon, Governor. You were talking about losing restrictions. We know what that means. You know, people are going to start conducting business in person, and there's the expectation that we're going to see more positive cases. So my question is, what would it take for you to bring back restrictions on businesses?
You know, what I really think, Sergio, is that we can operate businesses in a safe way. We certainly don't make the assumption about what's going to happen to our caseload in the future. We certainly hope that what we see in our state is the efforts around testing and contact tracing and safety requirements or safety guidelines for businesses going forward will continue to mitigate the spread. You know, social distancing has become a part of our way of life, and we have to, in fact, strengthen that way of life going forward as we move out into this next level of opening our economy. So we believe that we can do this in a way that doesn't overload our healthcare system, and we have backup strategies in case that happens, but we believe that we can actually prevent that from happening. We will follow the data just as we have from the beginning of this, and we will watch closely what's happening to the case counts, to the hospitalization numbers, to our positivity rate, to our expanded testing results. All of those things will be what we look at as we go forward, which will allow us to make decisions about which businesses open in the future, when, and what adjustments we have to make to those openings as a result of that data.
Governor, that you're looking forward, as in we are already starting to open businesses, and we are trying to monitor this data to open more businesses. But to the question, would you consider adding back restrictions? Is the answer no?
Oh, I think that, you know, depending on what happens, there's nothing off the table, never has been. We make adjustments to protect the public safety. That's what we've done all along. When there's an imminent public danger, you make decisions. And when there is a public safety threat that is changing and that is unexpected for some reason, then there's nothing off the table.
Next, we'll go to Shannon Sharp with WTVC. Shannon, your line is open.
Governor, this may be more directed for Dr. Piercy, but since the state's numbers are only updated once a week for nursing homes, can you tell us about the cluster of cases at the Life Care Center of Athens? Family members are telling us there are at least 50 additional cases there.
The only thing I can tell you about that is that they were scheduled for mass population testing today. I haven't heard otherwise, so I assume that's going forward, and it'll be probably 48 hours, 2 days before we have those results back. That's the only information I have about that facility.
And just to follow up, are there any plans to up the reporting for nursing home cases instead of just doing it once a week?
Right now, that seems to be working well. It takes us some period of time to get those in the computer after they're resulted. It actually doesn't take long to get them in the computer, but to get them in through the lab and to collect from all over the state. And I think we've talked about it before. There is usually a lag in what you hear through family or even staff reports and what we report, because not only do we confirm the labs themselves, but then we make contact and confirm that we've got all the right numbers because we want to make sure those numbers are accurate. So because of that process takes a little while, we've been updating those once a week. It's not off the table to do it more frequently, but right now we're just at once a week.
Next, we'll go to Andy Scher with the Times Free Press. Andy, your line is open.
Thank you. Governor, in a statement on Sunday, Chattanooga Mayor Burke said that he was made aware only on Saturday that the governor's most recent order would supersede the city's orders. And he said, yesterday I learned that despite public and private assurances otherwise, the city of Chattanooga would not be making its own decisions for the reopening of restaurants. What specifically what happened there? Why was he not made aware? It appears that that he thought the situation was A, and it turned out to be Y.
Yeah,
well, that's a major difference there. And surely that comes back to you folks, does it not?
Well,
was something not communicated well, or?
Well, as I said to you, we've talked with, and I've talked with every mayor in every municipality. Our team has been communicating on a regular basis with those mayors. The county health departments make the decisions about opening and developing their own strategies. That's clear that that county health department drives those decisions. And so other than our efforts to and what I know to be continued communication back and forth between mayors, I can't speak to anything differently. I haven't talked to Mayor Burke about it since the weekend.
Well, I mean, was it the fact that that maybe was it made clear enough to the mayor that the county health department would be calling the shots and not the mayor?
Sir, the county health department makes the decisions in those 6 counties. We are making those decisions for 89 counties, and we're communicating with leaders from across the state and have been.
All right, thank you.
Thank you.
Next, we'll go to Jason Lamb with News Channel 5. Jason, your line is open.
Thanks, Governor, for taking my question. On the loosening of the restaurant restrictions, you've talked a lot about, even today, about following the data and changing things at the right place and the right time. You just mentioned the data you're going to be looking at going forward. But beyond the hope and belief that this loosening of restaurant restrictions is going to go well, what data or information have you specifically seen already that this compliance is going to be a different story on a large scale than what you saw with individual Tennesseans still moving around before you had to issue that stay-at-home order?
Jason, the restaurants opened today, and we will certainly watch and see how Tennessee businesses respond. We're very encouraged by what we've seen even so far today, but these businesses have been open for half a day now. Some of them, they've certainly been allowed to be open. Some have chosen not to open yet because they don't feel like they're ready. We trust this process. We know that it will be one that works for Tennesseans' health, safety, and for reopening our economy.
And Governor, you did mention Puckett's as one example, but what about restaurants in more rural counties where they may not have a lot of cases even right now, and these owners of these restaurants are, have been losing money each day this has been going on, and they may feel, well, we can maybe let in a little more than half or, something like that.
You know, like I said earlier, I'm not going to make the assumption, I'm not starting with the assumption that Tennessee business owners are going to do the wrong thing. I have trust and faith in the people of Tennessee. They have done exactly what we've asked them to do, which is why we are in this position today. Business owners are eager to get back to work, but they're eager to get back to work in a place that provides safety for their customers, safety for their employees, because they know that is what will have people coming into their restaurant. So I have a great deal of faith and trust in the people of Tennessee, and I have a great deal of hope about what the days ahead are going to be like for our state.
Thank you, Governor.
That's all the time we have for questions today, Governor, if you would like to make a closing statement.
I just want to thank everybody again for for tuning in to listen to our updates today. Things are changing rapidly in a very positive way in our state. We will continue to monitor vigorously and daily what is happening on from a health standpoint in our state, because as I've said before, the health and safety of Tennesseans is the primary driver in all of the decisions that we're making. But we believe, too, that we can, in fact, begin this process of getting Tennesseans back to work in a way that continues to provide for that health and safety. But it'll happen only if Tennesseans continue to do what they've been doing for weeks. I encourage you to continue to do your part and stay apart. Thank you very much.